Thank you so much for joining us today. We are thrilled you are here. We are not using a mic so that it doesn't interfere with our virtual transmission. So I hope you can hear me okay. I can step out here. This is really our first annual WeLEAD Inspirational Speaker Lecture. We are thrilled to have Dr. Dan Pesut joining us. I think you'll find this to be a really, really wonderful lecture. Before we get started with that, I do have a few people to acknowledge. We've had tremendous support in getting today organized, getting all of our unique students here, getting all of you invited, getting our virtual audience organized. So really thanks to Gloria Joseph, who had incredible energy and worked so hard and sent me so many emails, and I know she sent me. So thank you, Glory. As well for all the folks who have really helped, and that's Margaret Laniger, Cassidy Shull, Kim Hodges, and Shannon Holliday. So let's all thank them. Kelly Walgass is here, and I always forget this. So Kelly, here's the disclosure slide. I showed you this. Okay. Attendance at this activity can earn you 1.5 contact hours through the Penn State Ross and Carol Nese College of Nursing. To receive those hours, you must attend the full program and complete the evaluation provided at the end of the program. Penn State Ross and Carol Nese College of Nursing is approved with distinction as a provider of nursing continuing professional development by the Pennsylvania State Nurses Association, an accredited provider by the American Nurses Credentialing Center's Commission on Accreditation. The topic of this education is non-clinical, and therefore we did not identify, mitigate, or disclose relevant financial relationships. Right. Always forget that. So let me take a moment and introduce our very distinguished speaker who we are incredibly honored to have with us this afternoon. Dr. Pesut is a nurse educator, academic, researcher, consultant, and coach. He has held academic and administrative positions as an emeritus professor of nursing at both the University of Minnesota School of Nursing and Indiana University School of Nursing. You were also in South Carolina. In Michigan. He earned his PhD in nursing from the University of Michigan, a master's degree in psychiatric mental health nursing from the University of Texas Health Sciences Center in San Antonio, and a BS degree in nursing from Northern Illinois University. He completed postgraduate training in integral studies and alternative dispute resolution, which I'm sure comes in very handy. Yes. For all the things we do in life. He is a graduate of the Harvard Institute of Higher Ed Management Development. He is a certified Hudson Institute coach. While he was on active duty in the U.S. Army Nurse Corps, he created the first psychiatric clinical nurse specialist position at the U.S. Army Institute for Surgical Research, Brooke Army Medical Center, Vermont. He is the past president of Sigma Theta Tau International. He is a fellow in the American Academy of Nursing and the Global Academy of Holistic Nursing. He is the recipient of multiple, and I underline multiple, national and international awards, and has served on the National Advisory Council of the Robert Wood Johnson Nurse Faculty Scholars Program. He is best known, and I think he'll speak to you about this today, for co-creating the outcome present state test reflective model of clinical reasoning and his work in futures thinking and foresight leadership. Sigma Theta Tau International created the Daniel J. Pesut Spirit of Renewal Award to honor his leadership legacy and contribution to the nursing profession. His lecture today will be on principles and practices of legacy leadership, recalling, reclaiming, and recasting. With that, I welcome Dr. Pesut.
All right. Hello to all the virtual people and all of the people here.
So I'll go ahead and start while Matt gets that together. And so my goal today is to share with you a little bit of my story in terms of nursing and sort of the things that I've learned along the way and resources that I think might be useful to you as you continue your professional development and your career. And my contact information is up here if you ever want to get in touch with me. And here are our objectives for the day: to define the concept of legacy leadership, to inform your personal and professional reflection and action concerning leadership contributions in nursing education, practice, research, and policy. To describe 5 practices of legacy leadership to gain insight into ways of being, doing, and thinking about legacy leadership. And I'm a firm believer that if you know your values, you know your strengths, and you know what your contribution is, it becomes your North Star in terms of guiding you in terms of the development of a career legacy in nursing. So I'll give you some references and resources to explore on your own in that regard. And then to recall, reclaim, and recast your professional nursing journey with legacy leadership in mind. And I just had a glance at the posters next door, and it sounds like some of you in this class have already tried to move in that direction. Kozes and Posner said, legacy are passed on in the stories we tell. So I'm going to tell a few stories today about my experience through time. And one of my actually coach and mentors was John Schuster, who was a part of the Hudson Institute. And he's actually written this book about the art of recalling, reclaiming, and recasting your past. And he says that when we recall with curiosity our memories, we can think in new ways about them and can begin to dismantle our habituated views of who we are and aren't, resetting the specifications of our lives. So recalling, I was born in this little hospital on December 12th, 1951, in this little town of DeKalb, Illinois. This is St. Mary's grade school. One day I was called to the principal's office in 8th grade, not knowing why I was called to the principal's office. And there was Sister Mary Trinita and Father Kane, the pastor of the parish. And they said to me, Father Kane and I have decided you are the most responsible boy in 8th grade. And therefore, you need to become a priest. I did the same thing. I just laughed. My jaw dropped down. And I was like, are you serious? What are you talking about? I would never be. But what's a 14-year-old boy to do, right? When Sister Trinita and Father Kane tell you, you need to go to the seminary. Well, I went to the seminary, 4 years of high school, 2 years of college. And I decided, I don't know that I can actually do this for the rest of my life. And so that's sort of a story about identity. And so while I was in the seminary, I used to work summers at a nursing home as an orderly. And there was a husband and wife team, both RNs, who I respected very much. And they said to me one day, have you ever thought about nursing as a career? And I said, nope, never have thought about nursing as a career. And they said, well, you're really good at it. You ought to try it. And I said, I couldn't afford it. It wouldn't be possible. And they said, oh, well, there's a great program. It's called the Army Student Nurse Program. The Army will send you to school and you can become a nurse and you can kind of move on from there. And I said, okay, I'll give that a try. So fast forward, 1975, I graduate, commission, first lieutenant, went to Brooke Army Medical Center there at Brooke Army Medical Center. And it took me 6 months to realize I didn't have the skill set I needed to take care of these patients who were so severely burned, because many of their problems were not physical, they were psychological. So I struck a deal with my head nurse and I said, I'll work permanent evenings and nights if I can go get a master's degree in psychiatric mental health nursing at the University of Texas Health Science Center and come back and help me build my skill set to work with these people who are suffering with pain and disfigurement and loss and grief and mourning. I mean, that was a whole set, a constellation of things that were a part of their experience. And she said, sure. So I did. I went to school during the day full time and I worked evenings and nights. I loved evenings and nights because nobody else was around. You were in charge and it was just a great way to be. And got the master's degree in psychiatric nursing. And as Susan said, started the first clinical nurse specialist position in psychiatric nursing at the Brooke Army Medical Center burn unit. Did some
research with the staff about stress and depression and research with families and that sort of thing. So I really like this guy, Marshall Goldsmith. He says, if you want more joy in your life, there are like these 4 questions you have to answer. Who do you think you are? What have you done lately? Who do other people think you are? And when can you let go? And I appreciate Marshall Goldsmith because he talks about the complexity of identity. And there are really 4 identities you have to navigate. And I kind of had the experience of navigating those 4 identities. And it's, you know, what others see in you, what you see in yourself. So clearly prescribed, Sister Trinita and Father Kane were very prescriptive, was other people's view of my future. And I thought, okay, fine. Reflected, Frank and Judy McAmel, have you ever thought about nursing as a career because you're really good at it? Reflected back to me, other people's, based on my past and experience with them. And then there's this remembered identity. It's sort of as you grow and as you develop through time, how do you put together all of your experiences and the feedback you get from other people and your own aspirations and your own views of what it means to be caring or spiritual or purposeful in life. And it kind of is a mix. It's kind of like your past based on others' prescriptions and your future, and it's all developmental. And so, but then there's this other identity. It's your created identity. And that's the self that you want to create in the future based on all these experiences that you've gathered from people through time. And so that's when I started to reclaim what I wanted to be, who I wanted to develop. And reclaiming is about revisiting things thoughtfully and thinking about what you want to contribute to the world and how you want to discover what parts we're underdeployed and recommit to the values that are important to us. So that's when the Army said to me, after my 3 years of active duty were up, our plan for you is we want you to go and be a director of a 91C program, an LPN program at Fort Tacoma, Washington. And that's what you'll do for the next few years until we figure out something else for you, another prescription. I said, I don't want to do that. It might be time for us to part ways because I've been in this master's degree program and I really am now committed to nursing knowledge and nursing knowledge development. I want to know more. I want to be more. I really like it. If you send me for my PhD, I'll commit to the Army for 40 years or 39 or however long. I says, I'm here. I'm yours. They said, well, that's not our plan for you. Prescription. And I said, well, that's not my plan for me to stay here. So I left and got a teaching position at the University of Michigan. And so I really do believe this. The future happens at the intersection of knowledge and services. And if you have the knowledge, you can provide the service. And there's a rich heritage of nursing knowledge. And there's future heritage, future legacies of nursing knowledge. Many of you are in this room that will develop nursing knowledge. So I've had a rich kind of academic experience, starting at Northern Illinois University, where I had a profound imprint experience. I was taking a nursing research course, and my instructor at the time was Beverly McElmurray LaBelle. And I wrote this paper for her class. It's called Portrait of a Researcher. And she brought me to her office one day, and she said, do you know how smart you are? And I went, what? And she says, you really have got this down. And that was so affirming. And it was like another reflection of my identity. She worked with me and Elizabeth Carnegie, who was the editor of Nursing Research at the time. And that essay is published in Nursing Research, 1975, Portrait of a Researcher. And it was my trying to make sense of what does research in nursing really mean? And how is it that you sort of have to live the life of a researcher and a life of inquiry in order to make things happen? And also at the University of Michigan, my PhD program, I had a great bunch of colleagues. I loved my PhD program. It was so invigorating and inspirational. And this research culture about highlighting the positive aspects of being a PhD student really resonated with me. And I really got into the knowledge work associated with nursing science and nursing theories and nursing concepts. I can remember the first book I read in my PhD program was The Conduct of Inquiry by Abraham Kaplan. And he talked a lot about paradox. And one I remember is the paradox of conceptualization. In order to have a good theory, you need a good concept. In order to have a good concept, you need a good theory. And so I was sort of struggling with all of that in terms of trying to make sense of that and put all of these things together in terms of that. And so I got really interested in the notion of knowledge complexity. And Verna Alley is another one of my sheroes about knowledge evolution, expanding intelligence. And she puts these three things together, that knowledge, action, and consciousness about time and space really kind of is the configuration of this knowledge complexity dynamic. And all of a sudden, things fell into place for me in terms of, whoa, nursing knowledge is really got a lot of things to develop over and through time. And so this whole knowledge complexity archetype became sort of a filter for me, an organizing framework. Most people today talk about data, information, knowledge, and wisdom. But Verna Alley puts things together in a little different way. She says, after you've got the data and the information and the knowledge, you've got to engage in some meaning making and philosophical perspectives before you get into all of the different dimensions about what it requires to perform in terms of action and to do research. And so she's got this sort of hierarchy about moving from data to information to knowledge to meaning making to philosophy to wisdom, a sense of renewal, and then to unity, right? Union. And so this might be a little hard to see, but this organized my whole world. It's kind of like, okay, time is important. You can be right now, very present oriented, expanded present, think about the future, be long-term, compare and contrast the past and the future, or be very long-term, or be timeless in terms of foresight. And then that has to do with how you come into the world in terms of awareness and consciousness. And there are all these different levels of consciousness. And this is your knowledge orientation that influences your thinking and learning, that influences the action, and that influences performance. This made total sense to me in terms of my PhD program and development of nursing science writ large. I could really get my hands around this. And so I also had a chance to study in my master's program as well as my PhD program, grand theorists. And so I am so grateful for the people that have developed this website. If you do not know nursology.net, you need to put it on your favorites and page mark it and go and look at that, because they kind of trace the history of nursing ontology, ways of being in nursing, and epistemology, ways of thinking and reasoning and gathering information. And this is their logo. I love this logo. It reflects the Roman god Janus, being able to look two ways, look to the past and look to the future. And two heads not only represent honoring of the past, but progress towards the future. And the red flame coming from those two heads represent evolving insights that arise from the unity of minds, the life, knowledge, energy, and emotion that illuminates and informs both insights and understandings that are expressed in nursing knowledge. I love this website. It's a repository. It's about heritage, but it's also about legacy. And so, interestingly enough, next week, they're having a week-long global virtual nursing conference about nursing theories. So you can go to nursology.net and register. So immersed in all of this along the way was this notion I developed that science presupposes creativity. You have to be creative in order to generate a question and come up with a novel association to investigate. And so my dissertation was about the metacognition, the self-regulation of creative thought in nursing, because I realized if we could get nurses to be more creative and innovative, boy, could we accelerate the science and the development and the studies that people would do. And so I did that research and developed a creativity training program for practicing registered nurses. And lo and behold, there were significant differences in the pre-test group, the post-test group, and when I switched them around, when the controls became the subjects. And so my scholarship through time has really changed. I started out clinically looking at volitional psychosomatic self-regulation, but then got into metacognition and creative thinking. That led me to the development of the clinical reasoning model, the OPT model, involved in nursing education research. How do you get nurses to think about their thinking? How do you help people become aware of being aware? I then get that whole notion about foresight and anticipation and thinking where you've been, hindsight, and thinking where you want to be, foresight, giving you the insight you need to kind of make a change and a decision. And then I got into some complexity science, and I got into some integral theory, and then I got into some coaching and leadership development. And of course, along the way, put some of this down in paper. When I was inducted into the Academy of Nursing long ago and far away, one of the things they say is, what's your contribution going to be? So Carol Anderson, who was the editor of Nursing Outlook at the time, I said, you know, we're the Academy. We should be thinking about the future. Where in any of the Nursing Outlooks things do you talk about future think? She says, I don't know. I said, well, I have an idea. I said, I'd like to write a column in the Nursing Outlook on future think. And she says, okay, I'll give you one page, way back when, 1997 or whatever it was. So I wrote the column in Future Think, defining what Future Think was. And she came back to me and she says, could you do this column again? And I said, yes, I think I could. And I ended up doing 36 columns in Nursing Outlook from 1997 to 2005 about Future Think, helping people anticipate trends about genetics, distance education, intellectual property, copyright, some of those things. And I really enjoyed that in terms of stimulating peers and colleagues to think more about the future. And then, of course, the clinical reasoning books and some of the stuff about leadership. All of this led me in later years to really focus on foresight, because I think it's lacking, and people are more in the here and now, or people become what Frederick Hudson calls future blind. We get lost and trapped in yesterday's decisions. We're overwhelmed with the complexity of things. And so foresight, futures thinking became kind of a red thread for me. So at the University of Minnesota a few years ago in 2017, we created this summit on nursing foresight and put together a website with resources and references for people, nursingforesight.org. It has consequences for all of us, especially planetary health, which is an emerging thing. If you're not very future oriented, if planetary health isn't on your radar, then it needs to be. And so this guy, Jonathan Nadler from Australia, provides this framework. And I offer this framework for you to explore and relate and reflect on, because he identifies these key concepts, domains, and these are all future literacy skills. So when you have time, you can take this document and maybe on a scale of 1 to 5, rate yourself and say, oh, on a scale of 1 to 5, 1 being not so much, or 5 being, I got it. What's your sense of play? What's your open-mindedness? What's your agency, resiliency, empathy, collective mindset? How good are you at story building or your communication strategy? This is future thinking on one page, and it's got all of the literacies, the domains, and some of the key concepts. And I think he has a little assessment tool. You can go to his website and fill it out, and he'll tell you where you are on some of these different dimensions. So that became important, as well as the whole notion of planetary health, getting involved with Nurses for Alliance of Nurses for Healthy Environments. I was part of the group that initiated this movement. It's, those of you who don't know, Nurses Drawdown. It's a movement about nurses doing 4 things, paying attention to 4 areas on the planetary health drawdown project that they can do to change the course of the future. So I invite you to go and explore that. Oh, one. And then there was the Sigma years, right? So I forget what it was, 1997. Eleanor Sullivan was the president of the Sigma Theta Tau International, and she came to me one day and she said, Dan, I want you to run for the board because we need more diversity. We need more diversity on the board. And I did, and I was elected. And I served on that board for 8 years. 2001 to 2003, I was the president-elect, and 2003 to 2005, I was president of that organization. And so very proud of all the things we did during that. And that's where this notion of legacy leadership, I think, comes in. I love these people, Sandstrom and Smith, who have got this great website called Legacy Leadership, and written a couple books on the Leader's Guide to Lasting Legacy. They say it's not about leaving something behind. It really is about influencing others to cause a change, a shift from unconsciously doing leadership to consciously being a leader and living your legacy now. And I thought, wow, that's what Sigma did for me. Getting to people to change and think about things in a different way and do it in the now rather than later. And so obviously a rich history. 6 students at Indiana University went to their dean and they say, we want to establish an honor society based on 3 things: knowledge, learning, and service. She said, I'll have no part of it. She says, you're not going to do it because it would set people apart. It would cause division. And the students were persistent. And she finally gave in. And so the Honor Society of Nursing was established in 1922 at Indiana University School of Nursing. And legacy, talk about changing people's thinking from consciously doing things away from unconsciously doing things, all the things that they have accomplished. And they just celebrated 100 years. This 2023 was the 100-year anniversary of Sigma Theta Tau. And so this notion of changing people and challenging people to think about things differently in the now so that things would be better there then, this was my presidential call to action. Create the future through renewal. You can see my red thread of futures in there. You can see my creativity in there. You can see my challenge to people. And so I wrote my presidential call and I asked people to pay attention to renewal in 6 areas. Yourself, service, scholarship of reflective practice, science and knowledge that supports evidence-based care, social value of nursing worldwide, and spirit. And this was the preamble I wrote to a task force I created, put some very cool people on this task force from all over the world, and asked them to put together a white paper, resource paper on reflective practice and what that would mean for nursing. We're talking 2003, 2005. And this is me in a nutshell. Personally and professionally, I believe reflection is a means of renewal. My logic goes something like this. If self is renewed, commitments to service come forward more easily. Renewed commitments to service require attention to mindfulness and reflective practice. Mindful reflective practice begets questions that support inquiry. Inquiry guides knowledge work and evidence-based caregiving. Caregiving supports society as knowledge, values, and service intersect. Knowledgeable people, especially knowledgeable nurses, provide care that society needs. Creating a caring society is the spirit work of nursing. Creating a caring society starts with nurses caring for themselves and becoming, through reflection, more conscious and intentional in their being, thinking, feeling, doing, and acting. Reflection is a form of inner work that results in the energy for engaging in outer service. Reflection in and on action supports meaning-making and purpose management in one's professional life. It sort of is the essence of my reflective practice challenge. Well, little did I know, getting people to think in a new and different way, people on that task force went on to write textbooks, multiple textbooks and resources about reflective practice. Visionary Leadership in Healthcare was just published last year by Holly Way and Sarah Horton-Deutsch. It's all about reflection, won the AJN Book of the Year Award. Reflective practice by Sarah and Gwen, who were both on the task force. They've gone on to develop all sorts of great resources and workbooks available through the Sigma website, reflective organizations. So those reflective practice resources, I think, were evidence that people were thinking differently in the here and now about what was important. And they were making unconscious biases conscious in terms of the development of nursing knowledge work. Another piece of legacy, I don't think many people know this at all. When I was on the board, I saw all of this intellectual capital in the Honor Society. And then I saw all these needs that were going on among the board of directors and some of the staff of the Institute. And I said to Nancy Dickinson Hazard, you know, we got to do something about marrying the intellectual and social capital of our organization into the needs of the organization into the future. So what can we do to kind of tap that resource of people and use it in a strategic way? And so we came up with this notion of the VIP, a volunteer interest profile. So Nancy said, okay, we can do that. And that program has just exploded. And so you can go on the Sigma website now, sign into the circle. You can fill in a voluntary interest profile, but things you're interested in. And if staff or headquarters have needs, they go right to the VIP profile and they match people who have interests with what the needs of the organization are. And they develop strategies to kind of connect those people and bring the social capital and the intellectual capital of the organization together. So that, I think, is another legacy input. So how do you develop this leadership consciousness? I had a great conversation with people this morning with the faculty at breakfast, and we talked about some of these things. Well, fundamentally, it's about self-mastery, inner work, knowing your strengths, what your values are, logical levels of perspective and understanding how systems interact with each other. It's about an outcome orientation versus a problem orientation. It's about polarity management. It's about paradox. It's about understanding the complementary nature of things that you're experiencing. It's understanding the difference between change, which is about fixing the past, and transformation, which is about creating a future. It's about sense making with all of these different skills. And it's about that attention to self and renewal in terms of what is important to you. I like this guy too, Lance Secretan. Whoa, spark flame torch. He's got an interesting strategy. He says it's important to know your why be do statement. Why are you here? Who will you be? And what will you do? And he has a way to get at it. He asks people to think of the thing that's most terrifying to them, most awful, the worst thing in the world. And he calls that the terror threat that you're struggling with. And then he asks you to flip it. What's the opposite of that terror threat? And he calls that the terror fix. And if you can manage the flip between what you think is awful, awful, awful versus the opposite, he says, that's what you're called to do. That's your destiny. That's your destiny statement, your why be do statement. One of mine was negligence. I think it's awful that negligence is so prevalent in the world. And if you look in the dictionary, the opposite of negligence is nursing. So every day we're managing the tension between nursing and negligence. And I also think being future blind is awful, not paying attention to the future. What's the opposite of future blindness? Foresight. So managing the tension between foresight and future blindness is another red thread that I have. So he also talks about the essence of leadership, and he boils it down to mastery, chemistry, and delivery. Mastery is about what you have to learn. Chemistry is about your ability to empathize with people. And delivery is how well you listen to people's needs and how you serve them to meet those needs. So I've done a lot over the years in terms of leadership consciousness. You have this first person perspective, but you can also step inside the shoes of somebody else, a second person perspective. There's a third person perspective when you're looking at the system. There's the collective perspective that you're looking at the we. Robert Sternberg talks about moving developmentally through three different stages of mind: socialized mind, which you get along with what everybody else says; self-authoring mind, when you kind of become to create that identity that you want to create; and then self-transforming mind, when you kind of go beyond that and continue your development as you ascend the developmental scale in terms of vertical leadership. And there's a lot in the leadership literature now about the difference between horizontal leadership and vertical leadership. Horizontal leadership is getting a skill, getting a skill, getting a skill, getting a skill. Vertical leadership is thinking about things in a different way, really valuing diversity, asking different questions, putting together the sense making of the system. And there's some great references and hyperlinks here in terms of that. So Robert Quinn, another one of my favorite leadership scholars, talks about normal consciousness, where you're self-focused, externally directed, internally closed, and comfort-centered, and the nature of leadership consciousness, where you're other-focused, you're internally directed about examining your values, the match and mismatch. You're externally open, and you move outside your comfort zone, and you're purpose-centered, and you clarify what your North Star is and what your compass is in regards to moving through that. I also love this Barrett levels of consciousness model, which I invite you to explore, because it's all about development. And something happens between 38 and 40. You kind of have this pivot at that fourth level of evolution, where you begin to think about things in a new and different way. And so it becomes important to manage that. So I think leadership is a process of influencing aspirations, behavior, and circumstances. It's the alignment of that vision with outcomes, action, ethics, and resources in a network of relationships. And I love this guy too, Robert Dilts. He talks about meta leadership, macro leadership, and micro leadership. And I don't think many people appreciate the systemic perspective of this in regards to the kinds of things that can happen. And we sometimes get stuck at different stages. This is the model. It says that fundamentally the environment dictates how you behave, but your behavior depends on your capabilities. Your capabilities depends on your values and beliefs, but your values and beliefs depend on your identity, who you are, and your identity depends on your spirit or contribution to the greater universe. And you can go up and down these logical levels. So I often, when I consult, I listen, at what logical level are people having this conversation? And we talked a little bit this morning about, I think nurses sometimes get stuck at the identity level when we really should be talking more about the for whom spirit level, the contribution beyond what nursing can offer folks. Lots to explore here in terms of the history of logical levels. The other thing I've learned along the path is this whole notion about reconciling opposites and how you can use things to sort of juxtapose present state, desired state, nursing, negligence, comfort, pain, anxiety control, and how that opens possibilities up. And there's actually a name for this. It's called the squiggle sense. Engstrom and Kelso have put that together in terms of looking at the squiggle sense, which exposes the truth that its complementary aspects and their dynamics are required for understanding. And so both and both rather than either or. And another skill I think every leader needs is this whole notion about life is bipolar. Everything contains its opposite. And if you don't know much about polarity intelligence or polarity management, add it to your skill set now, because it is going to be crucial into the future. These folks in Barry Johnson say there's a difference between a problem to solve and a polarity to manage. And there are all kinds of polarities in healthcare today. And it's not an either or, it's a both and. So this group is great too, Conscious Leadership, 15 Commitments of Conscious Leadership. If we had time, I would show this little video that's linked here, but we don't, which is why I developed key points of the presentation, and it should be a link, a hyperlink that you could get in your Zoom invitation. You can go and explore more in regards to that. But they talk about being above the line or below the line. If you're below the line, you're a victim. You feel oppressed. You think, ain't it awful? If you're above the line, you're open and you're more concerned about learning what you can do and how you're a part of the problem. And these are the 15 commitments which keep you above the line in terms of the work that you do. So these are the Beatitudes of Legacy Leadership, according to Sandstrom and Smith. And just think for a minute about your own skill set, where your learning edge is, and rate yourself on a scale of these. A holder of vision and values. Are you a 1 or a 5? Are you other-oriented? Are you a guardian? Is it seamless? Are you values-driven? Are you a systems thinker? If not, where would your learning edge be? Creator of collaborator and innovation. I've witnessed so much here about creativity and collaboration. I share with the dean. There's an esprit de corps here that I've not experienced in other schools of nursing where I've been. And whatever it is you're doing to keep that magic alive, keep doing it because it's pretty impressive. Influencer of inspiration and leadership. Are you relationship driven? Are you aware of your impact on other people? Are you inspire yourself? Are you a mentor? Are you positive? Where's the learning edge for you in that? Advocator of differences in community. I think we all have a learning edge here in terms of that. Calibrator of responsibility and accountability. To what degree are you results oriented, an analyst, vigilant, committed, aware, alert, answerable? Where's your learning edge there? So it's not about leaving something behind, it's about influencing others to cause a change, a shift from unconsciously doing leadership to consciously being a leader and living your legacy now. So I want to give you a little chance to engage with each other. I'm going to give you about 3 minutes. This is called Think, Pair, Share. It comes from this Project Zero Thinking Routines Toolbox from Harvard. A lot of great resources there for folks that want to do more with their teaching and learning. So find a partner and then think for a minute. I used to think about legacy leadership. Now I think about legacy leadership. Ready, set, go. Okay. So how do you recast this? You confront the negatives of the past and recast lessons in ways that expand stories and contributes to the capacity to do life work. John Schuster. Answering Your Call is another great book he's written, but recasting. So I think you recast it by paying attention to what people say is the good life. And this is what Leiter and Shapiro write about in their book, Repacking Your Bags, Lighten the Load for the Rest of Your Life. And they say, the good life is being in the place you belong with the people you love, doing the right work on purpose. I think it gets pretty simple, but they said there's some fears and antidotes. So, right, you got the tension here again, the fears and the antidotes. And they say many people have fear of meaningless life. The antidote to that is work. Being alone, the antidote to that is love. Being lost, the antidote to that is having a sense of place. And dying, and the antidote to that is having a sense of purpose. And so I have come to believe that appreciating the value and wisdom of knowing your strengths, your values, and contributions is important to creating a leadership legacy. And in my leadership courses that I develop, I try to encourage people to develop active wisdom, which is the application of intelligence, creativity, and knowledge to the common good by balancing their own, others, and the institution's interests over the long and short terms. You got, again, that oscillation back and forth, so that you can adapt, shape, or select environments in which you operate. And there are great resources available to help people do this. I embed all of these in the courses that I teach and some of the coaching that I do. The 34 Strengths of Strengths Finders, Rath and Conchi's book, Strengths-Based Leadership, is an excellent resources. The Values in Action, VIA Inventory from the Character Institute in Ohio is another great source. Life's Greatest Question is another book with an assessment that you can do to figure out what your contribution is to the world. And then the Barrett Personal Values Summary. So I offer these to you as a future reflection and help you with your inner work as you move along in terms of crafting your own vision statement. Here's a comparison of what the Strengths Finders does and the VI Character Survey will do in terms of the different domains and key questions and validity and some of the science behind it. These are the values and virtues of the character assessment. I happen to score pretty high on creativity, curiosity, judgment, open-mindedness, love of learning, and perspective. I'm very distressed when I do this because the lowest score I get is zest. I don't have much zest, but I have a lot of wisdom, curiosity, creativity, judgment, open-mindedness. So I need to work on my zest, I guess. And this strengths-based leadership, you know, each of these strengths has its capacity to influence, executing, influencing, relationship building, strategic thinking. I oftentimes do human histograms when I do workshops and with faculty. I have people take the Strengths Finder, and then I have people go to the different rooms based on their strengths. How many are executing? How many are influencing? How many are relationship building? How many are strategic thinking? A lot of nurses are really good at executing. A lot of nurses are really good about relationship building. A lot of nurses really good about strategic thinking. The cluster of people in a corner that is the smallest is influencing. And I don't know why that is. And I know we're the most beloved profession by the Gallup people, most trusted. But if you look at other things, we're the least influential. And that's got to change. And maybe you guys can change that as we move into the future. They also say that what followers want in people from their leaders is trust, compassion, stability, and hope. And if you go back to this book, Strengths-Based Leadership, takes each strength and it tells you how you can build trust, compassion, stability, and hope if you've got that particular strength. It's a great resource and a wonderful learning tool. And then, of course, you know, we're not all visionary leaders. Some of us are crisis managers, relationship managers, performance managers, facilitators, but each of these is developmental in nature. And I think the older you get, the more alignment you can have with these different types of leadership in terms of your professional career and aspiration. I like this guy too, another one of the Quins with his son. A fundamental state of leadership is lift. How do you get people to lift? And they ask these 4 questions. What results do I want to create? What would my story be if I were living the values I expect of others? How do others feel about this situation? And what are 3 strategies I could use to accomplish my purpose? Great little heuristic for whenever you're stuck and you want to create lift. So legacies are not the result of wishful thinking. They're the result of determined doing. And the legacy you leave is the life you lead. We live our legacies daily, as many of the posters in the next room say, in terms of working with patients, working with team members, working with folks, touching people's lives one-on-one. The people you see, the decisions you make, the actions you take, they are what will tell your story. So there's some great books out there about reflections on this. I love The Mastering the Art of Self-Renewal by Frederick Hudson. I just finished reading The 100-Year Life. And I'm a boomer, right? So the boomer strategy is, okay, education, work, retirement. People that are not boomers, next generation, that's not going to work for you. It's not going to happen. It's education, work, multiple stages of life, multiple experiences. You have to save twice as much in order to survive in retirement. So on the references and resource list, there's a link to the summary of this book where it takes boomers and Gen Xers and millennials and talks about the differences that it's going to make, because many of you in this room might live to be 104. And that's a whole nother dimension of planning and thinking about the future in terms of your foresight. So here are some leadership legacy reflections. I know we're getting close on time here. So what lessons are you teaching in each and every interaction you have? What stories will people tell about you in the future? What will others learn from those stories? When you're gone, how will you leave your mark on an organization? Will the values you instilled and live by and endure long after you've left? Have you put into place a system that enables others to have a sense of clarity and knowledge and information about what needs to be effective? What's more important to you, the results you achieve or how you achieve them? Have you made the impact you wanted to in your work? And will colleagues remember you as someone who made a difference in their lives? Have you put into place a system that enables people to feel connected and how to respond to their work accordingly? Have you left an operating system that is not dependent on you to give your employees what they need to be successful? There are some great leadership legacy resources out there. And who was the person that presented this morning on legacy leadership about Wick? Vic. She had a great legacy mapping kind of process, but these are career legacy cartography portfolios for advanced practice nurses. And Pam Hines and her work is to create a career legacy map to assure meaningful work in nursing, asking yourself a couple of questions. What do you want to be different in nursing and healthcare as a result of your efforts? And what do you really want to be known for? And how will you organize your career and accordingly in that regards? So another little closure here. Think for a minute, what did you appreciate about this presentation? How did the information influence your thinking and feeling? And what, if any, commitment to action will you make based on what you learned? Give you a minute to reflect personally about that, and then maybe share with a colleague or a partner answers to these questions based on your experience this afternoon. Or another way to think about it, what concepts, ideas, or resources do you think was most useful? How might you use the knowledge? Why is the knowledge important, and why care about the information? A few other prompts to get your reflection and your creative juices flowing. So, ready? Find a partner, or you could do it in a troika or a foursome, a 1Z, 2Z, 4Z. Ready, set, you got 4 minutes, go. So what's your takeaway?
I'll go.
Oh, okay.
I thought it was real interesting, thinking about reflecting as a leader and how with being a leader comes great responsibility, right? Like you have to be strategic and thoughtful and mindful about not only how you're leading your team or managing your team, but how you yourself are going to like reflect on yourself and your style.
Yeah.
And not every style, one size fits all.
Right. So true.
Right.
Context matters. And what you bring to the context matters, right? Somebody over there, yeah.
Not specifically about legacy of leadership, but I really like this concept or idea where life is polarizing, right? It's not me trying to have a good day or a bad day. How about just trying to have a day?
A day. Yeah. Good, bad, the day, right?
That's what life is.
Right.
We accept that the lows are as important as the highs, we can, I guess, fully appreciate life.
Be here now, mindfulness, mindful leadership. Yeah, right.
I would just say, with the statement that you made about nursing being the most trusted profession, but we're like the least influential, that really like struck me, because I think that we should be influential, considering the power that nurses hold
Yeah.
in healthcare right now. It's an interesting setup, but yeah, I just thought that was really impactful.
Yeah.
So I took away from the
Very.
conversation.
One of the people online, Benji, is he says, I'm an influencer, he says, so, and he is. Somebody at home over here? Yeah.
I'm thinking the concepts are good for leaders' teams,
Mhm.
but they're also good for individual nurses. And a lot of what you've said, I'm practicing daily with one other person that I'm caring for.
Awesome.
And I can use that same leadership concepts.
Mhm.
And it's reminding me, as I'm coming towards probably the end of a career, I'm getting there.
Mhm.
But just because I didn't go up a corporate ladder, that's one thing I do disagree with a little bit. You don't have to go necessarily up
Mm.
to embrace those principles that influence who is in your circle.
Right.
And then the second piece is so many of your concepts are, and I always give a plug when I'm out for the program I work for, because so many of your concepts, mindfulness, self-reflection, were built into the nurse family partnership model. And like, did you hang out with Dr. Olds back in the 90s when he was creating it? Because their
Right.
concepts are right
No, I
there.
didn't hang out with him, but I am an ambassador now to the Watson Caring Science Institute. So Gene Watson's work on caring science and micro practices associated with caring in the moment and being more mindful are kind of top of mind. So thank you. Somebody else?
One thing that struck me with the entire presentation was that legacy doesn't have to mean that you're leaving your mark in big or large group. It just means that you're leaving a mark on one person, that could be
Right.
yourself, or just someone that you talk to, because anything that you say, any ideas that you give, any feedback that you're giving on someone's lives, that would stick to them.
Yeah, shift their awareness, shift their consciousness, shift their self-perception, their self-esteem, or just affirm them in some way, take them down a different path. Yeah. Awesome. Anybody else? Oh,
I've heard about nurse researchers, who brought it person, but, you talked about the nurse as a philosopher today. And that stuff is, and it's what intrinsically drives us forward, and what are those beliefs, and how we add to those beliefs, and what makes us us, and what makes us do what we do.
Yeah. Yeah. Nurseology.net will blow your socks off. Because there are a lot of nurse philosophers on that group, and they take nursing philosophy, nursing knowledge, nursing ontology, being nursing epistemology really seriously. So, yeah. Other folks? Okay, well, thank you very much. It was an honor to share with you.
And I want to just tell you, I think on behalf of the entire college, those online, those here, that your presentation was amazing. We so appreciate you pulling all of this together for us, sharing such a wealth of knowledge that you have around these concepts, and, you know, the learning has been amazing. Thank you so much.
Thank you.
Thank you so much.